Hi, my name is Peter Millett. I'm an orthopedic surgeon and shoulder specialist here at the Stebbin Clinic in Vail, Colorado. I'm here today to talk to you about our upcoming paper, Minimum 10-Year Outcomes of Arthroscopic Transosseous Equivalent Rotator Cuff Repair. I'd like to acknowledge the work of my co-authors who assisted with this paper. I think this is an important paper. It was a culmination of many years of work, obviously. First, identifying the anatomy of the footprint, then developing a technique whereby we could recreate that anatomy using arthroscopic techniques, and now performing that in a large series of patients and following them over many years to assess their functional and subjective outcomes, as well as their revision rates. And what we found was that there was a very high survivorship rate, very low number of patients that needed revision, less than 5% in this series. And that's significantly improved from some of the earlier studies looking at 10-year outcomes of open and mini open rotator cuff repairs, which had survivorships somewhere in the low 80s. So the important take-home message is that these techniques are working, they're durable, they are not only returning patients to high levels of function and giving them pain relief, but they're restoring them back to normal levels of function. And there's low revision rates and low complication rates. So I hope you read this article, and I hope it helps you in the care of your patients. Thanks very much.